Dr. Pakman, are you getting in your office a fair amount of people coming in and calling you and saying, look, my dentures don't fit anymore. They are broken, when they're in fact not really broken and nothing is wrong with them except the structure of the body was shrinking. It's almost like if you lose weight or gain weight, your pants just simply don't fit anymore.
That's true.
You tell us a little bit about it, what can be done, what should be done, what is some misconception out there, blah, blah, blah.
Right. Well, this is very, very common. What we find is the longer a person wears a denture, the more the ridges underneath the denture dissolve. Now, it takes place over a long period of time, but we find that within 5 years of wearing a denture, the gums have and the bone have significantly started to resorb, as we call it, or dissolve. So it does necessitate making a new denture, and the reasons for it are fairly obvious. When the gums shrink like that and the jaw itself closes down, people start to look much older than they really are. They develop lines on their face. They develop a sort of what we call an Andy Gump look, where the jaws just look really funny. So that's why usually every 5 to 10 years, we start thinking about remaking the denture. And it's very, very common. And what I've seen in my practice is by changing the denture, you actually can take 10 to 20 years off of a patient's appearance. So that's very, very desirable for most patients.
So basically you use the denture almost like a Botox to fill the whole thing up again.
Yes, actually it does. It supports the underlying facial structure.
Now, what about, with the invention of implants, the whole structure changed, and gums or bones don't have to shrink anymore because the body thinks that he has real teeth if you put in that metal stick. Now, what about but lots of implants, yes, can be expensive sometimes. So isn't there a new way to make dentures where you put 2 or 4 of those implants in it, still give him denture, but now the denture isn't so heavy pushing on the bone, and then the bone is structured with and basically you prevent the shrinking over the next 5 to 10 years the way normal denture do?
Right. I don't think I could have said it any better, Helmut. You were excellent. What basically the implants do is preserve the bone that's left in the jawbone, and then if a denture is attached to it, it really bears the brunt of the pressure from the denture, and the denture is not resting on the gum and the bone. So you do preserve the ridge underneath. And this is a very exciting thing, and we've been doing this now for many, many years, and we're finding that you can get away, for instance, in the lower jaw with just 2 implants, and the denture snaps onto those implants, and the patient has a denture that doesn't move, doesn't irritate, and what's more important, doesn't dissolve the bone.
Wow. So is that particular implant still taken out? That particular denture, is it still taken out like grandma used to do it in a class? Yeah? Right.
That type is. There are types that you use more implants, and the denture actually screws into the implants. That doesn't come out of the patient's mouth. But that, of course, presents a little bit more of a challenge for the patient to clean under the denture. I myself prefer the type that can snap out, and the patient can clean it themselves.
I see. And they're probably also in that moment still even actually a little bit cheaper because they don't have as many implants in it, right?
Exactly. Much more economical.
Okay. All right. Here we have it. So people who had a denture for a long time can still go into this newer model, so to say. They can upgrade, right?
Absolutely. Absolutely.
Wonderful. Thanks a lot, Dr. Pakman.
You're welcome.